Hi, I'm Dr. Felice Gersh, your integrative OBGYN doctor. There's been a huge focus these last several weeks and months on women's reproductive functions. And in order for you to really know what's going on, you need some details. You need some background knowledge. And that's what I'm here to provide. Today, we're going to talk about emergency contraceptives. This was in the news just last week when a major health center in Missouri, the St. Luke's Center Health System, banned the use of the morning after pill, also known as Plan B, and other emergency contraceptives, thinking that the Supreme Court decision that came down recently that banned the federal acceptance of abortions by taking down the Roe v. Wade decision and giving the rights to states to determine the feasibility or legality of abortions in each individual state. So they did not know how to interpret the law as it came out in Missouri, whether it actually precluded the use of emergency contraceptives. Well, it turns out, happy to say, that it does not. And so they reinstituted the use of the emergency contraceptive pills. The thing is that they're still very concerned. They're not sure what the law is actually saying. Well, let me talk to you about emergency contraceptives. Well, what are some major points? I want you to have immediate takeaways. Number one, there are two types of emergency contraceptive pills. They have actually different mechanisms in terms of what they contain, but the outcome is similar, which I'll talk about, but they're not the same in terms of their efficacy. One of the pills is more effective overall than the other. Additionally, there are also emergency contraceptive IUDs. The copper T IUD has FDA authorization as emergency contraception along with the pills. And here's another huge takeaway. There is no evidence that the IUD causes any sort of abortion or has any impact on a fertilized egg. It is completely agreed upon in all medical scientific circles that the emergency contraceptive pills do not act as abortion pills. That's why they are not at this time illegal in any state, and hopefully it will remain that way. Okay, so let's talk about the emergency contraceptive pills. I've said there are two types. Okay, the over-the-counter type is a progestin. So it's a progesterone mimic, like an agonist. It works on the progesterone receptor as if it were progesterone, although it is not progesterone. That's why they call it a progestin. And the particular molecule that's in this type of morning after pill or emergency contraceptive is Levonorgestrel, 1.5 milligrams taken in one dose. Now, levonorgestrel is a very common progestin found in many oral contraceptive or birth control pills, such as low estrogen. So it has been around for a very long time. When it's in a birth control pill, it's in a smaller dose. When used as a single agent in a higher dose, it can help to prevent ovulation. So it will not prevent implantation of an already fertilized egg. That is so important to know. It interferes with ovulation. That's the release of the egg. That's why timing is so important. When taken, it should be consumed, swallowed, as soon as possible when something happens that is potentially going to create a pregnancy that is undesired. You have to take the levonorgestrel optimally as soon as possible, as I said, but within 72 hours. That's like 3 days. You need to take it soon or it will not work. And the longer the time passes since you had a sexual activity, when you had intercourse that involved penile vaginal sex where there was release of sperm. That's why every emergency department, every one, offers every female rape victim emergency contraception. That is the standard of care. Now, that said, there are some states where it is left as optional to the hospital or the doctor whether or not they're even going to offer a rape victim emergency contraception. But that is, to me, a huge violation of the oath of a doctor or the duty of a hospital. Emergency contraceptive pills that include levonorgestrel need to be given as soon as possible, and it doesn't have to be the morning after. It could be 5 minutes. It could be 1 minute after. Sooner is better. Now, if you took it ahead of time, that's not going to do it. So this is not a prophylactic pill. This is a post-sexual event pill. So it's emergency contraception after the sexual activity, not before. It's not taken beforehand. It's not used as a birth control pill. And this is also important. It is not as effective as a birth control pill. So what is the efficacy? Well, when used right away, like immediately after the sexual activity, it can be close to 90%, like over 86% effective. The longer the time passes, the less effective it becomes. Now, what's the other emergency contraceptive pill? It goes by the brand name of Ella. Now, the Levonorgestrel is over the counter. You do not need a prescription. You can walk in. And by the way, you don't need to have any age. You don't need permission. You just can buy it. Any female can buy the Levonorgestrel pill. The most commonly known brand name, and there are other brands, is Plan B. Now, Ella is a different compound altogether. It's not a progestin, it's a progesterone antagonist. So it works not to mimic, but to block. So it's not a phony baloney progesterone like levonorgestrel. It actually blocks progesterone. Now, what this does is it completely, very successfully, when taken properly, can prevent ovulation. It can prevent ovulation even as ovulation is occurring. It can alter the quality of the egg so that ovulation will not occur. So that's why the Ella pill is more efficacious, significantly more, like over 60% more effective than the morning after pill that has levonorgestrel when taken right away. Now, the other thing about the Ella pill, which is a progesterone antagonist, is that it can be given up to 5 days after sexual intercourse and still be effective. Now, the longer the time that passes, once again, the less effective it becomes. So that's another very important thing to know. Now, when you compare the two, I mentioned that the Ella is significantly more efficacious than is the levonorgestrel or Plan B. As well, once you get out, like even just 3 days or 72 hours after intercourse, it is still close to 50% more effective than Plan B. But remember, the levonorgestrel can be bought over the counter, whereas the Ella requires a prescription. It's a good thing for every sexually active woman to have one of these or both of these types of emergency contraceptives on hand so that if something happens, you are prepared. Because remember, the sooner the better. The fewer minutes that go by, the more efficacious it is. Now, what about the copper T IUD? It can be placed in the uterus up to 5 days after intercourse. And here's something that's important to know. It is the most effective of all the emergency contraceptives. And once it's inserted, it is then usable as a contraceptive for the next decade. So for a woman who can get in to her gynecologist and get a copper T inserted within 5 days of when intercourse occurs, and sooner is always better, she will then have contraceptives, if that's what she's looking for the next decade. Now, how does the copper T work? It's different. It's not anything to do with progesterone. It's not like a mimic. It's not an antagonist. It works to change many things. It probably interferes with sperm function, mucus production, the function of the fallopian tubes. So it is different, more complex in many ways, creating inflammation in the tubes, in the cervix, in the uterus. So it has a more global effect on all of the reproductive organs. So it's complex, but it works in a variety of ways to help prevent conception. Okay, so here's the takeaway. In this day and age, and particularly in states where abortion is not going to be available, but no one wants to have an abortion. So we want to prevent unwanted pregnancies. So we want to use effective contraception, but when that fails or when a woman has forced intercourse against her will, we want to have some options. So we have the Levonorgestrel pill, also known as Plan B, and there are other brand names. We have Ella, which works as a progesterone antagonist. The Levonorgestrel can be placed preferably immediately, but up to 72 hours after intercourse. The Ella can be taken up to 5 days, and then we have the copper T IUD, which is actually the most effective, and that can be placed also up to 5 days. Nothing is foolproof. Pregnancy can still happen, so prevention is the best way to go. As much as possible, to use caution so pregnancies do not occur when not wanted. So I hope this is really helpful for you to understand the role of emergency contraception. Take care and see you soon.